Hey, hi, and hello, everybody. I'm Meg, and this is M&M in real life. This week is going to be a continuation of last week, so we're going to talk about Ehlers-Danlos syndromes type 4 and 5. But first, we're going to check out that medical disclaimer. This video is for informational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician with any questions you may have regarding a medical condition. Always consult with your doctor before starting any exercise program or doing anything contained in these videos. Always stop if you experience any pain, discomfort, or difficulty performing anything I may describe in these videos. Welcome back, guys. Thanks for watching that. So let's get right into it. Ehlers-Danlos syndrome type 4 is also known as vascular EDS, and it is considered one of the more severe types. And similar to the others, it is passed down in an autosomal dominant manner. So if one parent has it, there's a 50-50 chance that their child could too. Several of the symptoms remain the same, such as the stretchy skin, easy bruising, hypermobile joints, and additionally, there are certain facial features that would stand out and are more common in vascular EDS, such as thin lips, a small chin, thin nose, and large eyes. Also, a congenital clubfoot or congenital dislocation of the hips can happen as well. And someone who has these symptoms, who have deduced all other diagnoses, would then want to get their final diagnosis and see a cardiologist because of the way that vascular type affects the heart and the lungs. I am not personally sure what the steps would look like in order to get a vascular EDS diagnosis. And what all would have to be checked out. But there are some links in the description with some additional information that might be able to help anybody that may think they have those symptoms. As far as I can tell from the research, treatment options are basically the same. Everybody's a little different, so each treatment type could be a little different, but the end goal is the same, to hopefully reduce most of the symptoms, if not all. I mean, let's face it, all of them never go away. So that's it for type 4. And moving on, next we have Ehlers-Danlos syndrome type 5, which is also known as X-linked. And X-linked means that there's a genetic mutation in the gene on the X chromosome that causes the symptoms to only be expressed in males. So it's mostly not seen in females. The symptoms may present themselves in the same way as other types, so the stretchy and velvety skin, hypermobile joints, abnormal scarring. It's common that eventually a person with this type would develop polyvalvular disease and die of congestive heart failure. So polyvalvular disease is where any valve in your heart has become diseased or damaged. Treatment options, again, remain the same. They'll vary per person, but again, overall goal is just to reduce the symptoms that you can. And EDS type 5 is considered extremely rare. I actually honestly didn't know all that much about it until looking it up for this video. So I had never really fully looked into it or heard of it for that matter, at least considered X-linked EDS. But all of this information from the video today is included in links in the description for today's video. So hopefully if you're interested or you may have those symptoms or know a loved one or just looking for information, those links should at least be a good starting point. I wish I could find them all. I do. but I'm going to try to keep each one specific to each video. That way, if anybody ever wants to come back and look at them, they fall under each category. So thank you guys for tuning in today. Please like and hit the subscribe button, and tune back in next week. We're going to talk about postural orthostatic tachycardia syndrome, also known as POTS, and it's as fun as it sounds. So I'll see you guys next week. Bye.